In medical education, there are these two words that get thrown around and mixed up all the time: assessment and evaluation. Now, they might sound like they mean the same thing, but trust me, understanding the difference is a total game changer for both learners and educators. So let's break it down and get this straight once and for all.
So, what is the real difference? And maybe more importantly, why should you even care? If you've ever felt a little fuzzy on this, you are definitely not alone. But stick with me, because by the end of this, it's all going to be crystal clear.
You know, the easiest way to get this is with a really simple metaphor. Think of it like this. One is the coach, on the sidelines with you during practice, helping you get better. The other is the judge, sitting up in the booth deciding if you've won the championship. If you can just hold on to that one idea, everything else we're about to talk about is going to click right into place.
Okay, let's build on that foundation. When you really strip it all away, you find that assessment and evaluation are just trying to answer two completely different questions.
First up, we've got assessment. This is 100% the coach's job. It's all about figuring out how a student is doing so you can give them feedback to help them improve. It's what we call formative. It happens during the learning process. The whole point isn't to give a final score, but to fuel that continuous growth. And then you've got evaluation. This is the judge. See, it's not really about one person's learning journey. It's about making a big judgment call on the program itself. You're asking, is this course actually working? Is the curriculum any good? This is summative. It looks at the final outcome to make those big picture decisions.
And boom, right there, that's the core difference. Assessment is zoomed way in on the individual. How well are you learning? But evaluation is zoomed way out, looking at the entire system. How well did the program work? One is personal and developmental, the other is systemic and decisive. Okay, foundation is set. Now let's really put these two concepts side by side. We're going to see how they stack up across a few key areas, and this will really lock in the difference between our coach and our judge.
This table really tells the whole story, doesn't it? Just look at the pattern here. For assessment, the coach, the focus is always the individual student. The purpose is formative, meaning it's there to form and shape the learner. And the timing? It's ongoing, happening all the time, just like practice drills. Now flip over to evaluation, the judge. The focus is the whole program. The purpose is summative, to summarize the quality. And the timing? It's episodic, happening at specific, high-stakes moments. It's the championship game.
So theory is great and all, but let's get practical. What does this stuff actually look like out in the real world, in the day-to-day of medical training? Let's take a look at the actual tools of the trade for both the coach and the judge.
The coach's toolkit is packed with ways to give real-time feedback. You've got things like a Mini-CEX or DOPS, where a supervisor is literally watching you perform a procedure. This stuff happens right there in the moment, so you get instant pointers. The whole idea here is to create what we call psychological safety, a space where it's okay not to be perfect because the real goal is just learning, not a final grade. Now, in contrast, the judge's tools, well, these are all about the final call. Think about the big ones, like the USMLE licensing exams, or that final high-stakes OSCE, the simulated patient exam that often decides if you pass. The whole vibe here is completely different. The pressure is on, because this isn't practice anymore, this is the final performance.
So we know the difference, we know the tools, but so what? Why is this distinction so critical? Well, it's because the impact of each one is felt in completely different ways, and it affects both the individual learner and the entire institution.
And right here, you can really see those two different spheres of influence. Assessment has a deeply personal impact. It shapes a student's learning, their confidence, even their ability to self-correct down the road. But evaluation, that has massive institutional consequences. We're talking about things that can affect a whole school's funding, its accreditation, its future.
When it's done right, good assessment is incredibly empowering for the learner. It's not about pointing out what you did wrong. It's about shining a light on specific gaps so you can fix them. It builds the confidence to try again, and maybe most importantly, it teaches you the skills for self-reflection and lifelong learning, which are absolutely essential for any physician.
The consequences of evaluation are just as profound, but they operate on this huge macro level. This is how the system maintains its standards. A good evaluation can mean a program keeps its accreditation and its funding. A bad one can trigger major changes in policy. At the end of the day, it's about accountability to the public, ensuring our medical programs are actually producing competent doctors.
So it might feel like we've set up this big showdown, coach versus judge, but it's not a battle. The most effective educational systems out there, they know they need both.
They aren't opposing forces at all. They're actually two sides of the same coin, working together to create this powerful cycle of improvement. And this is how they work in perfect harmony. All that constant, low-stakes data from assessments, all those coaching moments, that provides the raw material. When all that data is collected and analyzed, it feeds directly into the high-stakes program evaluation. That's the judging. The judge's findings then lead to real changes that improve the curriculum, which in turn makes the coaching even better. It's this beautiful, reinforcing loop.
Ultimately, it all just boils down to this. You can't have one without the other. A truly effective system needs that continuous, supportive feedback from the coach to build skills day to day, and it absolutely needs that final, objective accountability from the judge to ensure quality in the long run. So I'll leave you with this question to chew on. In our own work, whether we're learning or teaching, we tend to focus a lot on the judge, don't we? The big exams, the high-stakes outcomes. But where can we make more room for the coach? Where can we create more opportunities for that low-stakes practice and feedback? Because that's where the real learning, the real growth actually happens.